For this study, we were really interested in finding out how residents experienced extra care housing, but particularly what happened when their needs for care changed and how those changes were responded to.
The nature of life wherever you live is that things change, and that was definitely the case for our residents, and we got some really important findings from being able to go into the sites 4 times over a 2-year period.
So for many of our residents, they've spoken to us about their needs for care changing over the short term and how they were provided with extra care for a short period of time and then managed to recapture their independence. So the system works. And for some people, it provided opportunities for greater social engagement, but not for all of the people we spoke to.
Residents in extra care housing had, in some cases, really formed a sense of community. They behaved like they'd been friends for life, and it wasn't just important for them socially, it was also important in terms of reducing how much formal care provision they received.
But there were tensions about extra care turning into residential care, which were raised by some of the older people we spoke to, as well as some of the care workers. And certainly older people had noticed that residents moving in more recently had higher needs than they had in the past, and they felt that that was changing the nature of the community that lived in their setting.
The voices of people with dementia have often been lacking from research. So for me, one of the big advantages of the ECHO project is that we were able to really listen to the people who live in extra care housing as well as those who work there and the commissioners. And that has brought home, I think, the importance of having opportunities for social interaction, particularly for residents with dementia. And extra care housing does offer huge potential for that, but only if things are provided in a way that is accessible for residents and taking into account the needs of people with dementia in particular. It's certainly given us a good feeling of what the real questions are and what the real challenges are for extra care in supporting people with dementia, and hopefully we'll be able to develop further projects that look at those in more detail now that we know what the real issues are.
I think I'm really hoping that the findings, particularly around independence, can be informative for providers. We know people like to live independently, but we've got this assumption that we know what that means for people, and I think we just need to go back a step and really question ourselves and say, do we know what that means for people, and actually hear the voices and look at the experiences of the residents we spoke to during the ECHO project and see how that can shape our understanding of what independence means to people.
By talking to residents and gaining their perspectives and being able to present them to others, we'll show how important it is to take those voices seriously. It's important to talk to care workers and managers and commissioners, but actually it's the day-to-day lives of residents, of the people who live in these places, that we really need to be listening to if we want to make things better, if we want it to be a model that works.
So I think we've got to look at the intrinsic factors within someone and the extrinsic factors, the factors that are in their environment, and look to ways that can actually help people to self-determine, help them to navigate their own care pathway, and to be able to have a voice in those pathways.